Welcome to the Gladwell Laboratories Inclusive Tooth Replacement Solution. The tooth replacement solution is a comprehensive, restorative-driven implant treatment option for the replacement, temporization, and restoration of single missing teeth. This video will present a detailed overview of the components of the inclusive tooth replacement solution, as well as a review of the step-by-step process for ordering the components and utilizing the system in your single tooth implant cases. As shown here, all the components you will need for the placement and temporization of your case will arrive in one convenient box, including your original impressions and a drill guide reference sheet specific to your selected implant diameter and length. As mentioned earlier, the inclusive tooth replacement solution represents a comprehensive tooth-in-a-box approach to single tooth replacement. After receiving your RX and other pertinent data, Gladwell Laboratories will fabricate and return to you the components seen here. Essentially, there are really only three steps to this solution: the planning and implant placement itself, with the necessary implant, drills, and prosthetic guide. Then, once the implant has been placed, you have the option of either temporizing with a custom healing abutment or the custom temporary abutment and matching biotemp. And finally, once the implant is fully integrated, a final impression is taken with the custom impression coping, and a final custom abutment and crown are fabricated. The choices are either a titanium custom abutment, a zirconia custom abutment, or a hybrid of the two with the accompanying Bruxer or Emax crown. Now that you are familiar with the components of the inclusive tooth replacement solution, let's next examine, step by step, the process involved in restoring a case using the system. Seen here is a summary chart of the appointment steps needed, which will be examined in greater detail. The initial appointment is the consultation and data collection appointment. At this time, upper and lower PVS impressions and a bite registration are taken, as well as any preoperative photos. A shade is selected for the biotemp, and the implant length and diameter are selected. Once this information has been gathered, the custom Gladwell Laboratories Inclusive Tooth Replacement Solution RX is completed and forwarded, along with the impressions and bite registration, to the laboratory for fabrication of your components. Then, along with the components, you will receive back a pre-populated RX for the final restoration. Once Gladwell receives your initial RX and materials, the components will be fabricated and returned to you. The turnaround time is usually about 7 days. At the next appointment, with components in hand, the implant is placed and temporized according to your clinical judgment. Once the implant has been placed and temporized, the patient is discharged and the implant allowed to integrate as usual. When the implant is fully osseointegrated and the decision made to take a final impression, the patient returns to your office. The temporary abutment and crown or temporary healing abutment is removed, and the custom impression coping is seated and hand tightened to position to about 15 Newton centimeters. A full arch impression, as well as an opposing impression and bite registration, are then taken. The temporary components are then reassembled and the case is forwarded, along with the second RX, to Gladwell for fabrication of your final restoration. Upon receipt of the impressions and RX at Gladwell, your restoration and abutment are designed using CAD software and milled. This is usually accomplished in 13 days, at which time the final restoration and abutment are returned to your office for delivery. Finally, when the patient presents for delivery of their final restoration, it is simply a matter of removing the temporary components, seating the custom final abutment, and tightening it to 35 Newton centimeters. Full seating of the abutment can be confirmed with a PA. The crown is then tried in, any adjustments made, and luted with your cement of choice. Once the excess cement has been removed, the patient is set up for their routine recall appointment and allowed to leave with their implant retained crown.